Hello, everyone, and thank you for joining us this afternoon. My name is Eddie Miranda. I'm the Communications Specialist for Harris County Public Health. Welcome to our next media Q&A session on monkeypox. Joining us today are Dr. Erica Brown and Dr. David Pearce. Dr. Brown is the local health authority for Harris County Public Health, and Dr. Pearce is the local health authority for the Houston Health Department. Just a few ground rules before we proceed. Dr. Brown will provide an update on monkeypox cases in Harris County on behalf of both departments, and then we'll turn it over to our media partners for any questions. Since this session is being recorded, we ask that all our media visitors kindly put themselves on mute during the duration of this meeting. Please use the raise hand feature on the reaction tab at the top of the screen so that we can take your questions. Feel free to post the questions on the chat room as well, and we'll address them accordingly. And if any of I'll go ahead and queue in with anybody on the phone line if they wish to ask any questions over the phone. We will be sharing a recording of this Q&A with those attending this afternoon. Before we ask the questions, we ask that you introduce yourselves and your organization you serve as we go through the questions. Now we'll begin with an update from Dr. Brown. Go ahead, Dr. Brown.
Thank you, Eddie. Good afternoon, everyone. As of yesterday, Wednesday, August 24th, Harris County, including the city of Houston, had 492 confirmed cases of monkeypox. 405 of those were within the city of Houston and 87 within unincorporated Harris County. Texas had a total of 1,374. And the United States had 16,603. So with that, we can go ahead and open up for questions.
Thank you, Dr. Brown. And go ahead and turn the table over to the media for any questions. Y'all care to feel free to raise your hand. Any questions? Go ahead, Marcelino.
Good afternoon, doctors. Good afternoon, doctors. It's Marcelino Benito with KHOU. Thank you for taking our questions again this week. Dr. Brown, I'll pose this one to you, and Dr. Pearce, feel free to chime in after as well. Obviously, today we heard that there's our first positive case of monkeypox at the Harris County Jail. I'm curious, we heard from the folks at the jail earlier today, but as our leading public health authorities, what your thoughts are on that case and how easy or difficult it will be to contain that in the jail setting.
Thank you for that question. So we are in the very early stages of gathering information about that case, and certainly we'll keep you abreast as appropriate with the information. With regard to congregate settings, though, of which the jail is, just in general, it is important to get on top of the situation quickly, as we are working with Harris County Jail to do that and to provide support in a timely manner. Because monkeypox, the way it is spread is unlike COVID in that it is not an aerosolized transmission, that it lessens the risk somewhat. So again, while we absolutely need to be sure that we are coordinating and communicating as quickly as possible, it could potentially be a little bit easier for us to mitigate the spread because it's not aerosolized. And Dr. Pearce, certainly please chime in.
I completely agree with Dr. Brown's assessment because the unique way, well, not the unique way, because the particular way that monkeypox is spread and the fact that it doesn't spread very well in an aerosolized manner, we hopefully won't have the situation like we did with COVID. But I also want to give recognition to the medical staff at the Harris County Jail because across the entire pandemic in a overcrowded jail, over that 2.5 to 3 year period, depending on when you want to count the pandemic as having started, there were only 8 deaths related to the jail, COVID deaths, which is an infinitesimally tiny number compared to what we could have expected. The jail was overcrowded. That's a lot of people in close together where a aerosolized virus can spread very easily. They did a really, really fantastic job of containing that virus. this virus has its own personality. It doesn't spread nearly as easily, but nevertheless, there's a risk. And I have high hopes that the monkeypox spread within the jail will not be great. I mean, I think we have to expect that we have to plan for, we have to anticipate that there might be some. But I really want to point out that I think that the folks at the jail did a great job with COVID, and we should give them a lot of credit, and we need to give them the support so that they can be successful yet again.
Thank you, Dr. Purse and Dr. Brown for that answer. And thank you, Marcelino, for that question. Just want to go ahead and toss it out there to anybody else on who's joining us today to ask any questions or any further questions. Please feel free to raise your hand. Okay.
Yeah, I have a follow-up if that's all right.
Okay, sure. Go ahead, Marcelino.
What sort of difference does it make, if any, that these specific intake procedures? The county judge is holding a press conference right now as well. We just asked her about it, and she cited these intake measures that are being taken by the jail. This particular person was in a COVID quarantine isolation 5 to 10 day period that they typically do for all inmates, we're told now. So he was already isolated when these symptoms developed and they were detected. I'm assuming, as someone with no medical background, that's a pretty significant deal in terms of preventing further spread, or at least giving you a head start. Is that right?
Yeah, it is. And so again, as Dr. Purse said, the jail has done a phenomenal job at managing their COVID response in a very difficult, condensed congregate setting. And one of the measures that they put in place is to quarantine all incoming detainees for a minimum period of time to assess whether they are going to develop COVID symptoms. It so happens that particular process works extremely well with regard to monkeypox as well. So it's a great thing that they're able to now use that particular process to help manage their monkeypox response as well.
Thank you again for that question, Marcelino, and thank you, Dr. Brown, for that answer as well. Just want to see if there's anybody else out who would like to ask any questions, any further questions.
I got one more for you if no one's going to talk.
Go ahead, Marcelino.
The World Health Organization today noticed a decline in the cases globally. We're still, I believe, seeing an uptake in the U.S. I'm curious your thoughts on whether what we're seeing globally will at some point be seen here in the U.S., in particular with, measures that we're taking, public health measures that we're taking, and the increase in vaccinations. But is it a good sign that we're seeing at least not a dramatic rise in cases globally at this point?
Yeah, so I'll jump in and take that. And I think that the obvious answer is yes. It's absolutely a good sign that globally we're seeing at least a leveling off of the numbers. And in fact, if you look at New York City, they've had a leveling off of the number of new cases per day as well. That's a function of a number of things. One is that this virus does not spread nearly as easily as, say, COVID spreads. Number two is now that we have got a lot of awareness that individuals who partake in those highest risk activities, sexual encounters with multiple new partners, a lot of those folks, I'm hoping, are curtailing that activity until such time as they can get vaccinated. And then, of course, there's the vaccine. Now, we're still behind the curve on vaccine, but if people are aware of how the virus is transmitted and then they adjust accordingly until they can get vaccinated, those are things which will curb the increased number of cases and level it off and hopefully flatten it out until we can get enough vaccine into the population to really slow things down. Now, I say that, but again, I don't want, just with any vaccine, I don't want anyone to think that the vaccine is the be-all to end-all. This vaccine is about 85% effective, we believe, and that is after 2 weeks after the second dose. So back during COVID, I still hear people complain. I think that they're looking to make a point that, well, there's all this vaccine that went out and yet people still got sick and then some people died. That's true. However, the number of people who got sick was far smaller. We saw the number of new cases drop off dramatically after we started getting vaccine out, and the number of hospitalizations, particularly during this most recent wave here locally, I think is a great example. The number of hospitalizations was dramatically smaller percentage of the number of cases that we've seen previously, and the number of deaths dropped off. They didn't go to zero. Tragically, it did go to zero, but they dropped off. So the purpose of a vaccine is not to make you ironclad, but it's to reduce your chances of getting infected. And if you do get infected, reduce your chances of becoming seriously ill. So again, getting back to monkeypox, the leveling off is good, and people are empowered to protect themselves today while they wait for vaccine. And then after they have vaccine, you still need to be smart about how you manage your life.
Hello, Salome Briceño here with Telemundo. Could you give us a quick update on the number of cases of monkeypox here locally, and also what's the trend? Are we seeing, is it increasing the number of cases, still low risk locally?
Yes, thank you for that. So Harris County, total number of cases as of yesterday, August 24th, was 492 cases. Of those, the city of Houston had 405 and unincorporated Harris County had 87. We are seeing a leveling off, if you will. However, there's always a little bit of a lag in data, so we're diligently continuing to monitor. Both Harris County and Houston have a dashboard that is updated daily with this information, and so I think it's a little bit early to say whether we're truly seeing numbers fall, but we are optimistic about it, and the country as a whole still remains at low risk.
Dr. Peirce, do you have a quick update on, I missed last week's, but do you have a quick update on wastewater testing? Has that begun, or is it scheduled
for the
begin this week?
Yeah, so no, the monkeypox testing hasn't come. We're still waiting. I have to be honest, I have to double check with the team. My understanding is they're still waiting on delivery for the reagents, the chemicals that we need to do it. But again, for everyone else, the process has been validated. We had enough to to run the test and validate the process that we can, in fact, do the test. But our system is so big, we need a whole lot more of the particular chemicals, and so we're waiting on those. They should be soon, because there was about, I want to say it was about 2 weeks ago, they told us to be 2-3 weeks. So thanks for asking. I need to go back and double check, see where we are.
Thank you, Marcelino, and also Salome for your questions, Dr. Brown and Dr. Peirce for your answers. We have a question that came up on the chat room from Ashley Brown with Houston Public Media. And her question is, I know that the child monkeypox case ended up being a false positive, and other states have started seeing cases in children. What measures are being taken when it comes to children now that school has started back? And I'll go ahead and toss the question to both of you.
Yeah, so thank you for that. We are excited to hear that the case was determined to be negative. But even prior to the case, because although we're seeing the majority of spread of monkeypox among men having sex with men, it is possible, and we are seeing cases of spread among people outside of that vulnerable population. As you noted, there are a few cases across the country of children being infected with monkeypox. And so both Houston Health Department and Harris County Public Health had been working even prior to this case to develop educational plans and action plans to support schools, daycares, and congregate settings where children would be, especially going back into the school year. So we are reaching out to our local school districts within our jurisdictions, providing education about how to be safe and potentially disinfect if they were to have a case, making sure that they are aware of precautionary measures, especially with regard to small children, very similar to COVID, where we encourage them as best as possible with small children to manage the high touch areas and to educate small children, again, as best as possible with the littles about touching each other and showing extra friendliness with regard to hugging and things like that, because small children are super cuddly and we want them to be, but unfortunately this is a time where we need them to be a little bit more cautious. Was there another part to the question? I apologize.
Yeah, so her question, and going back to the question, is what measures are being taken when it comes to children now that school has started back?
Yes, so there is one other thing, and Dr. Purse, I certainly will turn it over to you as well. The vaccine, as needed, is also eligible for children down to the age of 6 months. So for those who do find them, those children who are in a position where they have been exposed to monkeypox are in a position where they meet the criteria for the vaccine, they are eligible to receive the vaccine, and we do have community partners with Texas Children's and other community partners who see pediatric patients who are assisting us in being able to provide vaccine. But again, for Harris County Public Health, there is an educational campaign that is ongoing with the school districts about how to disinfect and to keep the schools clean, and what to advise the student body and the employees should they have concern.
I echo everything Dr. Brown said. The only thing that I would add is that while we are seeing some cases of children getting infected across the country, and since our case here turned out to be negative, the ones that I have heard about from across the nation have been mostly they believe the spread occurred within the household. Now, monkeypox does not spread very easily in the respiratory spread, nor does it spread. We don't know how easily it'll spread with the fomites, like the cloths, the bed sheets, the sweaters, the towels, things like that. But we don't think that's a terribly effective way either. Neither is it very effective compared to what we're seeing in the adult population with a close, intimate contact. That is a very effective way. So children who are becoming infected at home are becoming infected because in all those cases, as far as I know, in all those cases, there was a known case within the household who was trying to isolate, but nevertheless, somehow the child became exposed. So the difference between those cases and the children at school is that, you're spending a lot of time at home, and depending on the age of the child, it could be really difficult for that child to keep themselves isolated from an infected adult that's in the household. Whereas at school, it is a different environment. So we are hopeful that all the measures that Dr. Brown just talked about are going to be effective. I don't think parents need to panic at this point. I don't think parents need to worry greatly at this point. I think that parents need to probably teach their kids, once again, things they probably been teach them, a little bit about good hand hygiene and just the usual sorts of things that'll keep you from getting not only monkeypox, but also COVID and influenza and rhinovirus and all the other viruses, those good standard personal hygiene measures that, it's difficult, to teach little kids how to do that. But that's our chore, and that's what we got to do. That's our charge, I should say, as parents.
Thank you, Dr. Brown and Dr. Purse, for those answers to the questions, and thank you, Ashley, for your question. Now I'm going to go ahead and leave it out. Just anybody else that wants to ask questions. Okay, no further questions? Okay. Let's go ahead and we'll make this wrap here. Just want to thank you again, Dr. Brown and Dr. Purse, and all our media partners for joining us this afternoon. Please continue to share information to the community about our monkeypox hotline numbers, as well as our websites. The hotline number at Harris County Public Health is 832-927-0707. And our monkeypox, and actually people can visit our monkeypox guidance page at readyharris.org. For the Houston Health Department, the monkeypox hotline is 832-393-4220. You can also visit houstonhealth.org for the monkeypox guidance information. And so just wanted to thank you all again. As I mentioned, I'll go ahead and share a recording of this conversation with all our media reps who attended this. And so, but hopefully you'll have a good afternoon, and we'll look forward to seeing you next time. Thank you all again.